We're back with the DSM video. We're talking today about personality disorders, cluster A. So the first of cluster A is paranoid personality disorder. This is 84. People with paranoid personality disorder have long-term, widespread, and unwarranted suspicions that other people are hostile, threatening, or demeaning. These beliefs are steadfastly maintained in the absence of any real supporting evidence. The primary approach to treatment for such personality disorders as PPD is psychotherapy. The problem is that PPD do not readily offer therapists the trust that is needed for successful treatment. As a result, it has been difficult to gather data that would indicate that psychotherapy is indeed effective. Therapists face the challenge of developing a kind of relationship, a trusting relationship with someone who is by nature paranoid, distrustful, suspicious, and sees others' malicious intent against them. Paranoid personality disorder is often a chronic, lifelong condition. The long-term prognosis is usually not encouraging. Feelings of paranoia, however, can be controlled to a degree with successful therapy. Unfortunately, many patients suffer the major symptoms of the disorder throughout their lives. 85, schizoid. What is schizoid personality disorder? People with schizoid personality disorder have little interest in developing close personal relationships with those around them. They will often appear to be extreme introverts and undesirous of close friends. They are seen as shy or loners. They appear to be dull, lethargic, and monotonous. They are also likely to be absent-minded. Cognitive behavioral therapy, group therapy, family and marital therapy, and psychodynamic approaches have also shown promise in helping those with schizoid personality disorder. Group therapy provides a socializing that would not otherwise be sought by the patient, and it can also be an opportunity to practice those skills. Role-playing is helpful for those as it helps individuals become conscious of communication cues given by others that they may come into contact with. Research has shown that success is found with principles from Alcoholics Anonymous, actually. They're implemented in a group therapy situation, and this kind of integrated approach with psychoanalytic object relations therapy will be critical in helping these people. So now we're going on to 86. Schizotypal personality disorder. What is it? Characterized by an ongoing pattern in which the affected person distances him or herself from social or interpersonal relationships. The affected people typically have an acute discomfort when put in circumstances when they must relate to others. These individuals are also prone to cognitive and perceptual distortions and a display of a variety of eccentric behaviors that others find confusing. A psychodynamic approach would typically seek to build a therapeutically trusting relationship that a lot of these people don't have. The hope is that to some degree of attachment in a therapeutic relationship would be generalized into other relationships. This can also be done through family therapy because a lot of the times family needs to know how to deal with these people as well. People even in their own home. More highly functioning schizotypals will have some capacity for empathy and emotional warmth. They tend to have outcomes that are better in psychodynamic approaches to treatment because they're able to connect with counselors that want to help them. Current research has found that since schizotypal personality disorder originates in the patient's family of origin, the only known preventative measure is a nurturing, emotionally stimulating, and expressive caretaking environment. Fortunately, a lot of these lack that.